The Manhattan trial was published in the spring of 2021. It's the first 4-drug combination with Carfilzomib, Lenalidomide, Dexamethasone, and Daratumumab in combination. It's a phase 2 trial with 41 patients. Patients received 8 cycles of therapy, and they had the option to collect their stem cells during the 8 cycles, typically after 4, but no more than 6 cycles of therapy. And after 8 completed cycles, the best response was determined in these patients. MRD negativity was the primary endpoint. 71% of the patients achieved MRD negativity, and this was in the absence of a bone marrow transplant. Patients were allowed to go to transplant after they had completed the study. So patients could be treated with 8 cycles, achieve MRD negativity, and go to transplant. Or they could collect their stem cells, and after 8 cycles, choose to keep their cells and go to maintenance. The study ended after the 8 cycles, just to determine the MRD negativity rate. I think it's important to put this in context. The GRIFFIN study, which is also a phase 2 study, randomized about 100 patients on each arm with VRd and VRd with Daratumumab. And a follow-up, the GRIFFIN study showed that 6 cycles of VRd with Daratumumab and the bone marrow transplantation is 51% MRD negativity, while VRd alone for 6 cycles with a bone marrow transplant gave about 20% of the patients MRD negativity. So here we have the Manhattan trial, 71% MRD negativity. Of course, caution you that this is not one large randomized trial, so it's not the same patients that were randomized between these different regimens. So we have to interpret it with caution. But the results look very, very promising.